In this chapter, we'll cover the drugs used to combat HIV, known as the antiretroviral agents, and use them to defend Camelot from the evil HIV White Wizard. You met him over in our sketchy micro course. This first sketch is going to cover nucleoside and nucleotide reverse transcriptase inhibitors, or NRTIs. And in this scene, NRTIs stands for none other than the legendary Knights of the Round Table. Get ready for tales of chivalry, magic, adultery, and lactic acidosis. First, we'll take a look at how NRTIs work. NRTIs are competitive inhibitors of HIV's viral enzyme, reverse transcriptase. If you recall our evil HIV human immunodeficiency wizard from Sketchy Micro, he had a spell book to magically convert RNA back to DNA called Reverso Transcriptum. And as you can see, our brave knights have gotten a hold of one of the wizard's books, which now lies open on the table in front of them. Because NRTIs are nucleotides and nucleoside analogs, they compete with other normal nucleotides to be incorporated into the DNA strand by reverse transcriptase. However, NRTIs lack an important hydroxyl group, the one that should be at the 3' location, which is necessary to form the next phosphodiester bond in the chain. Without this group, the DNA chain terminates prematurely. To show this, enter King Arthur at the center of the round table. He's rallying his men, slamming his mace on the table. Notice his mace looks like a nucleoside, a sugar bound to a nitrogenous base, and one of the spikes is missing. Yep, it's the hydroxyl at the 3' end, which is why DNA elongation is terminated. Let's add in the page numbers 3' and 5' to emphasize that it is the 3' to 5' phosphodiester bond formation that is inhibited, and a bookmark that looks like a halted DNA strand. As King Arthur rallies his men, readying his attack on this evil retroviral wizard, notice that he presents a scroll sealed with a P. This is because his NRTI knights, except for one member who we'll meet later, are not nucleotides but are nucleosides, and require phosphorylation 3 times. 1 to turn it into a nucleotide, and 2 for the energy required to form their bond to the DNA chain by host cell enzymes in order to be activated. Well, this scroll signal is officially activating his men, calling them to action to defend the castle. Take a close look at the round table. Looks kinda Christe-y, doesn't it? Yep, it's designed to evoke the image of a mitochondrion with all those squiggly cristae. This is because, as a class, NRTIs are associated with mitochondrial toxicity, which can present as peripheral neuropathy, pancreatitis, lipodystrophy, hepatic steatosis, or even lactic acidosis. Lipodystrophy involves the redistribution of fat from the extremities to the trunk, which can be clearly seen in the knight's majestic steed, whose gracefully thin legs look like they're about to collapse under its more centralized adiposity. Peripheral neuropathy can happen as well, and that's why this page boy is wearing our recurring symbol, the old white gloves, like the stocking and glove pattern of peripheral sensory loss. Whoa, did the icebox break or something?
More sour milk, my lord. It's especially green and frothy, just as you like it, sir.
Tasty, the perfect beverage before any crusade, and our recurring sketchy symbol for lactic acidosis. No, you first, I insist. Although it's a black box warning on these meds, it's quite rare in the ones in current use. And you know what? We all know that the Knights of the Round Table eat ham and jam and spam and, I guess, pineapples? So they've prepared a hearty feast. The suffix "dine," spelled like dine, is attached to a few of the NRTIs, a useful tip for recognizing them on exam, but not all of them have it. So, in this scene, they will be dining at the round table. Dining. Now, let's get into the individual agents and meet our knights. Meet Lamivudine, represented by a kicked-back and relaxed Sir Lancelot. If you ask me, it looks like he's a little bored of this whole affair. Wait, did someone say affair? Lancelot, no! Wait, really? Is it Guinevere? You can tell me. He has another secret, though. He's part of a medieval secret society, the Hippo Masons, whose crest is the hippo, the noblest creature of the animal kingdom. This is to remind you that lamivudine specifically is also used to treat Hep B, because the hippo is our sketchy symbol for hepatitis treatment. Also, as a little extra reminder, he's wearing a bee costume to remind you of our sketchy micro Hep B sketch. Note that in patients co-infected with HIV and HBV, discontinuing this agent can result in a flare of hepatitis, since it inhibits DNA replication for both viruses. Moving on to emtricitabine, represented here as Arthur's trusty and exciting blade, Excalibur. Importantly, emtricitabine is so similar to lamivudine that they are interchangeable and should not be used together due to competition for intracellular phosphorylation. One unique minor side effect is hyperpigmentation of palms and soles, represented by King Arthur's badass and very dark leather sword-handling gloves. Like lamivudine, emtricitabine also has activity against the hepatitis B virus, so we can glance again at the Hippomason sigil. The last in this trio of the secret Hep B Hippomason Society is Sir Tristan, who will represent tenofovir. Tenofovir starts with a T, so remember this is a nucleotide, not a nucleoside. However, its active agent mimics adenosine monophosphate, so it still needs some phosphorylation. But while the nucleosides need 3 phosphorylations, Sir Tenofovir only needs 2. So he can get started earlier than the others, which is why he's already sailing off on the tide, while the others must wait inside for that final P, still in King Arthur's hand. Okay, so maybe outside has side in it too, but then there's no tide inside, so it kind of works. Tenofovir is often manufactured in combinations with other HIV drugs to reduce pill burden, and there are actually 2 different forms, each attached to a different salt. Both formulations can lead to kidney injury and bone density loss, but the newer formulation is associated with less toxicity for both. Tenofovir is used in a once-daily combination with emtricitabine to prevent HIV infection in people who are at a high risk of infection, an intervention called pre-exposure prophylaxis, or PrEP. Note that we're not talking PEP or post-exposure prophylaxis. Remember that Tristan also has activity against hepatitis B, just like lamivudine and emtricitabine, and is a first-line monotherapy treatment for hepatitis B, so he's adjacent to the sigil of the Hippos Masons, or maybe they're the Hippo Templars. Or maybe they're the same, I don't know, Dan Brown always confused me about that. Turns out Tristan shares another quality with Lancelot. He also has a secret lover, of course. Isolde, and if I remember the story correctly, the king finds out, which is probably why Tristan is actually sneaking out early. Princess Isolde is dining at the table, and she'll represent zidovudine. Isolde's crest also incorporates a dove for zidovudine. Keep in mind that zidovudine is not first-line antiretroviral therapy because it's less potent and associated with way more adverse effects compared to newer NRTIs. She's a nucleoside, so we're back inside at the table. The most common side effect of zidovudine is myelosuppression, and that's why Isolde is dining from this dish that evokes an image of bone marrow. I have to admit, those erythroblasts look quite delectable. This can lead to anemia and neutropenia, which will be embodied in her white anemic-looking dress. And to emphasize granulocytopenia, she's holding our recurring sand timer of falling granules, counting the minutes until her lover's return. No Knights of the Round Table sketch would be complete without Merlin, of course, and we're going to associate him with abacavir, because abracadabra, need I say more? Abacavir can cause a hypersensitivity reaction that is strongly associated with the HLA-B5701 allele. So he's opened his spellbook to a spell titled HLA-B, and he's turned to verse 57, line 01. This spell results in the alteration in the presentation of self-peptides to the immune system, resulting in a delayed type 4 hypersensitivity that presents as a rash, which is represented by his spotted rash appearing on the arm of our absent-minded sorcerer. He looks kinda distracted, as usual, so he'll most likely have a delayed reaction. Merlin's magic potion test tube clogged up with yellow goo should remind you that abacavir should be avoided in individuals with coronary artery disease, as well as those with multiple risk factors for CAD, since it's associated with increased risk of CAD and cerebrovascular events. Think that's concentrated eye of newt? That finished our specific agents. Now, Before we get out of here, one last word on how to use these to treat patients. NRTIs make up the backbone of antiretroviral therapy, which should be started as soon as possible after diagnosis. Initial treatment regimens usually consist of a pair of NRTIs along with a third agent from another drug class, most commonly an integrase inhibitor. We'll cover integrase inhibitors in another video, but we'll just leave this key deflector shield on the battle plan to remind you. Recall that reverse transcriptase lacks proofreading ability, so mutations that can lead to resistance are common, so monotherapy is never appropriate. Alright, that finishes the first story in our Camelot saga. Let's sum up these NRTI Knights of the Round Table, shall we? Nucleoside and nucleotide reverse transcriptase inhibitors comprise the backbone of antiretroviral therapy. They work by competitive inhibition of HIV reverse transcriptase, as they are similar to nucleotides, but lack the 3' hydroxyl group, which causes the DNA chain to terminate, halting viral DNA synthesis. The nucleosides need 3 activating phosphorylations before they can be incorporated into the strand, but tenofovir, which is a nucleotide, only needs 2. Several agents are also active against hepatitis B and useful in co-infected patients, specifically lamivudine, emtricitabine, and tenofovir. Emtricitabine and tenofovir are also often combined together for pre-exposure prophylaxis, or PrEP. As a class, the NRTIs are associated with mitochondrial toxicity, which can lead to lipodystrophy, peripheral neuropathy, and lactic acidosis, among other things. Individual agents have specific unique adverse effects. Emtricitabine is associated with hyperpigmentation of palms and soles. Tenofovir may cause kidney injury and bone density loss. Zidovudine is known for myelosuppression causing anemia, neutropenia, and agranulocytosis. And abacavir is associated with increased risk of CAD and a delayed hypersensitivity rash in patients with a specific HLA allele. You know what, though? On second thought, let's not go to Camelot. 'Tis a silly place.
Ooh, coconuts!